Good morning, everybody. We are going to talk about classifications of hepatic encephalopathy. This is, of course, a very common situation we face in the practice, and we will try to classify and numericalize this. Of course, hepatic encephalopathy is the mental status abnormality with impairment of neuromotor functions like asterixis and hyperreflexia and so on as a combination. Of course, it was classically graded by a grade called West Haven criteria, which categorizes the hepatic encephalopathy into grades from grade 1 to grade 4 based on various clinical parameters like alteration of the level of consciousness, intellectual functions and behavior changes, as well as the presence of asterixis or absence. Those are the old West Haven criteria into grades from 0 to 4. 0 is the normal in everything, of course, and normal examination, and may have some impairment of something called the psychomotor testing or the minimal hepatic encephalopathy, where the conscious level and intellectual and behavior changes are not. Grades from 1 to 4. Grade 1 is a mild lack of awareness with shortened attention span and impaired addition or subtraction. When we give him a mathematical equations, he might be a little bit slow or slurred. Asterixis at that level might not be there. It could be present in a mild form or maybe simply tremors. Asterixis are more obvious from grade 2 and on. Of course, in grade 2, the patient is going to be a little lethargic, disoriented, and may exhibit some inappropriate behavior with the obvious asterixis and the slurring of the speech. And this is a most common form we face in clinical practice of hepatic encephalopathy. More advanced forms, like grade 3, where the patient is somnolent but arousable, with gross disorientation and bizarre behavior, with some rigidity, clonus, hyperreflexia, and of course asterix are there. Coma is the grade 4, where the patient is comatose with decerebrate posturing, and of course we cannot elicit the asterixis that obviously in such situations. The West Haven scale is criticized for its subjectivity and the extreme intra and inter-observer variability, especially in identifying the low grades like grade 1 category or grade 0 category, and those kinds of also. So we try to invent a semi-quantitative gold standard about to make it more reproducible. And so this is achieved through the World Congress of Gastroenterology by the year 1998, and they stated some changes. One of them, that the terminology of portosystemic encephalopathy should not be used anymore, because not all hepatic encephalopathies require the presence of portosystemic shunts. And they started to postulate other things, like to start to express hepatic encephalopathy grades in the form of axes. More than one axis. Axis 1 according to underlying disease, axis 2 according to severity of manifestation, axis 3 according to the time course, and axis 4 according to existence or presence of precipitating factors. Those 4 axes together are generated in the form of what's called nowadays SONIC. SONIC is the spectrum of neurocognitive impairment in cirrhosis, SONIC. So nowadays we express hepatic encephalopathy in the form of SONIC, those 4 axes. Axis 1, etiology, into 3 types, A, B, and C. A in acute liver failure, B in bypass liver failure, which is the portosystemic shunting, of course, and type C with the cirrhosis or the chronic liver disease. Axis 2, the clinical severity, which is similar to the previous West Haven, when there is unimpaired, minimal impaired, and the West Haven classes we all know. Unimpaired and covered are sub-classifications. So we sub-classified into unimpaired, minimally, and West Haven grades 1 to 4, and sub-classified into unimpaired, covered, and overt hepatic encephalopathy. Overt hepatic encephalopathy includes the minimal hepatic encephalopathy according to the Vienna definition, plus Westhaven grade 1 in absence of disorientation and hysterexis. It means all patients which are impaired a little bit and only detected through some tests like the number connection and subtraction and the mental grading of subclinical and minimal impairment encephalopathies. These are called overt hepatic. Or the overt hepatic encephalopathy includes grades of Westhaven criteria from 2 till 4, which include, of course, the asterixis, semi-coma, and coma. And so they are furtherly specified into grades 2, 3, and 4. Axis 3, which is the time course. Either it is episodics, bouts occurring more than 6 months apart, or recurrent, which are bouts recurring within less than 6 months apart, and persistent, where the patient all the time have some form of alteration and impairment of his mental function, like the slurred speech, the slow cerebration, the needs arousable. And of course, this reminds me, of course, with the truck drivers, they have some form of persistent hepatic encephalopathy. Grade 4 or the axis 4, sorry, either this is precipitated or spontaneous. Spontaneous, where there is no precipitating factors, and precipitated, where there is an event which precipitates this hepatic encephalopathy. This is going to be the table for sonic, as we can see, type ABC, grades minimal 1, 2, 3, 4, then into covert and overt, time course, episodic, recurrent, persistent, either spontaneous or precipitated, as we can see. So when we express hepatic encephalopathy patient, we usually report him in a form of 4 words or 4 axes. Let's have an example. A 20-year-old female, previously healthy, admitted to the intensive care with suicidal attempt with the overdose of acetaminophen. She became progressively drowsy, slow, as well as being intubated for the airway protection. Head CT was normal. Labs, of course, were unremarkable except for the elevated transaminases and the elevated international normalized ratio, INR. Patient is an encephalopathic episode related to the acute liver failure. Okay, yes. So how we are going to express? We have axis A1, which is ABC. So this is an acute episode. So this is A. What is the form of the grade of this patient? Patient is progressively drowsy and so on, so on, so. So this is the grade. This is an episode. Of course, we cannot express it in the recurrent or not. It's of course an overt encephalopathy. And lastly, this is not precipitated by something. It has a positive yes, but it is not precipitated. I mean, there was no chronic liver disease and something happened to it to precipitate it. So this is type A, overt, grade 4, because the patient is comatose and intubated. It is episodic and it is non-precipitated. So thank you very much. This video and my other videos are all present on my YouTube channel. Please feel free to join it and enjoy it. Thank you very much.